Hello and welcome to the installation video of BCC3900. Upon the package arrival, please inspect the package. Open the box and verify the packing list. Take out all the accessories and keep them on a safe place. Remove all the sheet cover and plastic tapes from the screen, reagent and printer area. Open up the screws of side and top cover. Remove the metal sheet covers from side and top of the instrument. There is a protective hook which holds the probe to move. Please open up the two screws and remove this hook and carefully observe if the probe can move right, left and up, down freely. Open the diluent reagent box. From the bottle cap you can see a barcode. This code is used for registration. Take out the diluent tube, remove the protector and connect one side of the tube with the instrument and insert the other side in the diluent bottle. Take out the waste tube bucket and tube. Remove the protector and connect one side of the tube with the instrument and insert other side in the waste tube. Take out the lyse reagent bottle and tube. Open the lyse reagent section and connect lyse reagent bottle with the instrument. Take out the printer paper roll and insert it in the printing area. Please take out the scanner box and connect the scanner base. Install all the covers back and tighten all the screws before turning on the instrument. Take out the power supply cable and connect it with the instrument. Before turning on the instrument, one must follow requirements for power and environment. Please follow this picture for detailed instructions. BCC3900 is a very simple and compact machine. It have only one power button. So here you connect the power supply and turn on the machine. These are 4 connections for the USB and I'm going to connect barcode scanner. This one is for LIS communication and this machine have only 2 reagents. One reagent is outside of the machine, there is diluent. Here you connect that reagent and this pipe is for waste. The second reagent is connected inside the machine. You can see its name is lyse. And before starting this machine, you need to make sure all of the connections are well connected. This is the front view of the instrument. So here, this is the touch screen and this is the printer. Before you open this machine, you turn on this instrument, you need to connect the paper just to print out all the information. And this is our probe. And when you want to start the test, this is the push button or test button. So when you want to turn on this instrument, you need to input username and password. Username is admin admin and password is 1. So you just need to press login. So after this, machine will take some time to do self-test. Maybe it will take 30 seconds. So it will do a self-test and then it will start to work normally. After the machine will be turned on, after the self-test, this interface will be shown to you. So let's start. First row is for functional buttons. So there are different kinds of function buttons you can see, and from the second row you can see there are patient information. So all of the information that is related with the patient will be shown here, and this area of the screen is given to results. So all of the results will be shown here, and this area will be shown for the histograms. And if there is any clinical information related with the test, so it will be shown here. If there is any abnormal flags or any information that is related with clinical, so it will be shown here. And the last part of the screen is for results management. So this interface will show us currently machine is working in which mode. Right now you can see it is selected WB, it means whole blood mode. So according to your currently chosen mode, machine, all of the results will be shown here. Before testing, we need to register our reagents. So for that purpose, you need to go to menu, and there are reagent tab. So currently, as I told you, this machine is simple and only using two kind of reagents. So here diluent and lyse. Here you can see there are two types of buttons. This is validity setting. You need to select any reagent and press validity. So here you can see actually this button is helping you to edit and save the life or expiry date of the reagent. So currently it is 2023 and I am going to change that to 24. So here you can see the life of the reagent has changed, and also you need to register. So press this register button, and here this interface will be pop out, and here you can see you need to input barcode manually or with the help of barcode reader. You can input all the information, or you just need to scan it and all of the information will be automatically shown into this screen. And if you want to input manually, just input that barcode from the reagents bottle or reagent box and input here, and all of the information will be shown here. After the successful registration of our reagents into the machine, this is the time we want to fill the pipeline. So for that purpose, you need to go to maintenance, and then there is a service button. Here you need to press fill tab, and here there are two kinds of diluent and lyse. So you need to press them one by one to fill all of the pipeline with these reagents, because currently your pipeline is empty. Before you start testing, you need to fill your pipeline. From the main screen, there is a button called mode. Here you can select any kind of analysis mode according to your choice. So currently this machine have three modes: whole blood, micro whole blood, and pre-diluted. So you can change any mode according to your choice. You can see right now the machine is working under this mode. There is also another button if you have bunch of samples and you want to use them as a list, so you can select this option, use work list. Also there is auto communication. That means you can connect with LIS computer, and that communication will be automatic and bidirectional. And press save. And also if you want to if you have selected that use work list, so go to sample, and also you can edit some of the information from this tab. So here you can also select some information if you are using work list. This is the calibrator from our dairy company. So before you take out this calibrator from your refrigerator, the temperature of this calibrator is lower than the room temperature. So please give it some time to reach at room temperature. And also inside the calibrator box, there will be a reagent insert or reagent leaflet that contain all the information that later on you will need to register the calibration. So before you want to use this calibrator, please make sure you want to shake it well. But there is a recommendation method for that shaking. If you want to use this calibrator, so please mix it upside down. If you shake it very hard or you shake it with the power, so it is possible you break all the cells inside this calibrator. So the recommendation method from our company is slowly and gently and upside down. After our Dirui calibrator is ready, it is time to do the calibration. So for that purpose, go to menu and there is a calibration tab. So here we have three different kinds of calibrations. So first we will talk about calibrator. In this method, we will use our Dirui calibrator and that is recommended from our company. So press calibrator and this interface will pop out. So first of all, from the calibrator insert, input all of the values into this reference tab. So one by one, input all the values here and then again put your calibrator under probe and press this button. So the recommendation method is that after 2 or 3 tests, again it is time to shake your calibrator for 2 or 3 times to get good results. So like this, do all of the 10 calibration, and after done all of the calibration, the mean value, CV and all of the results will be shown here. Then press tab. Save. Another way of doing calibration is fresh blood calibration. Go to menu, calibration and fresh blood. So in this interface, there will be 5 different samples and in total each sample will be tested 10 times. So make sure all of these samples have been tested from another machine and got all the accurate results. So that results will be registered here into reference tab. Here all of the results will be added and will be checked under WB or pre-diluted mode according to your choice. So please make sure all of the samples have been checked from another accurate machine. After you have done the calibrator calibration and fresh blood calibration, you can check all of the history from calibration history, and from the query tab you can check fresh blood or calibrator or manual. The difference between history, calibration history and manual is that the results of calibrator and fresh blood will be shown into manual, and here you can edit the results. You can see here you can edit, but in the calibration history you can only see the results but you cannot change them. This is the main difference between manual and calibration history. After the successful calibration, it is time to do quality control. So before we conduct quality control, I want to introduce, this is low level quality control, middle level and high level. You can differentiate them from their color: blue, green and red, low, middle and high. So the same method you did for calibration, you need to shake these QC slowly and normally. You do not need to push it hard because it is possible you can break cells inside. Before we conduct the quality control, we need to input some setting first. So go to menu and QC. So now you can see there are different methods: LJ, X bar R and XB. The same functions you can go to setting and QC. So you can see the same functions here. So in our machine, these are the first 3, these are the most commonly used method, and out of these 3, LJ is the most commonly used method. It is also known as level Jennings or average QC. So we will select this one and press save. Also we can go to LJ, and according to our calculation method, we want to choose absolute value or percentage or 2CV or 3CV. You can see 2CV and 3CV. If I want to start 1CV, 2CV and 3CV, the difference from one value to another is 5%. So 5%, 10%, 15%. So according to your choice, you can choose any option. and press save. Same goes for X bar. So press save, and then if you go to main screen, there is also a quick button, is called QC. So here currently it will show you under which setting your machine is working. So right now our QC is working under LJ. So here you can see first we need to input the settings. So in total we have 12 different files. We can save 12 different files in our QC setting. And in this one, when we open our QC box, so inside that one have all the lot number and grade information. Actually grade information means we have three different kind of QC: medium, high and low. So you can choose according to the reagent insert or according to your choice, and this is the expiry date. And then after that you need to input all the information from the reagent insert, and you need to input all the information from this one, this target, and save. And after save this one, go to QC count. This time you will conduct the QC. Press your QC here and then conduct your QC, and all of the results will be shown into result column. If there is any abnormal information, that will be highlighted in red color. So otherwise, if the QC is normal, it is shown in normal color. And after this one, you can check the QC diagram according to your selected choice. So the QC diagram will be shown into this interface. And after that, the QC history you can check from this menu, and you can send this information to list, or you can delete this information. The fourth QC method is XB. The difference between XB and above three method is that in all of the above methods we use quality control, and in this one we do not have to use quality control blood, but instead of using that one we use normal human blood, and that will be counted as our QC. So first select this one and press save and go. Right now you see the function is not turned on, so go to XB tab, open and save, and now the XB function is light up. So the purpose of using this XB is when you have bunch of samples like 50 or 100, then you select this option XB, and after conducting your normal human samples, so all of the results, all of the mean value of these items will be shown here, and according to XB the diagram will be shown here and the results will be shown here in this QC list menu. You can transmit these results to LIS, and also you can delete. Again, I would like to introduce the difference between above three functions and XB is that these three use QC blood and XB does not use QC blood. Instead of using QC blood, it is used the normal human blood, that if we have bunch of blood, so we use this sample to conduct QC.